And I'm starting. All right. Hi, everybody. Welcome to our third Facebook Live of Brain Injury Awareness Month. Today, we're going to focus on senior fall prevention. As we all know, senior falls are incredibly prevalent. They are one of the leading causes of brain injury, and seniors are extremely at risk. So today, we have some professionals with us from throughout the state that work directly with seniors and have some ideas for how we can all stay safe. Carolyn, do you want to start by introducing yourself?
Sure. My name is Carolyn Tassini, and I'm a physical therapist and board certified in neurologic physical therapy. I'm the rehab supervisor at Bancroft NeuroRehab in South Jersey, in Mount Laurel, New Jersey.
Great. Jillian, how about you?
I'm Jillian Gordon. I'm an occupational therapist at Bancroft NeuroRehab in Mount Laurel, New Jersey.
Thank you. And Laura?
Hi, everyone. My name is Laura Jacobs. I work for the Brain Injury Alliance of New Jersey. I'm an education and outreach coordinator, and I work through many of the senior centers throughout the state of New Jersey.
Right. So as we were just saying before, we know that seniors are incredibly at risk for falls and sustaining traumatic brain injury from a fall. Laura, do you have a sense of why seniors are disproportionately at risk?
Of course, many times when I go out and I speak with seniors throughout the state, and I'm approaching that age myself, I talk about that falls don't happen because of your age. Like it's not like you're 70 and all of a sudden you're going to fall. Many times it's other things that are associated with us getting older that cause the fall. And no matter what age you are, if you have those items going on, you can fall. So you can be 15 and fall from something and 70. But unfortunately, as we get older, we face many more of them, such as our vision starts to go, our hearing, wearing actually the hearing aid, making sure it works, our mobility. And a big one that many people don't even think about when they fall as a cause could be medication. So that's something we want to think about also. So that's some of the reasons why. And I know in a little while, I'll also go into other physical reasons.
Right. So is there somewhere, whether in the home or outside of the home, that seniors, tend to fall more often, and why might that be?
Yeah, it's funny because when I go out and I meet with all of the seniors, and I've met with like thousands of seniors throughout the state, some of them tell me, I don't go out from October through May, I stay in the house. But when I ask everyone, where do most falls occur? What is the answer? In the house. And so by staying in the house and staying kind of immobile, very little amount of walking, whether it's from the kitchen to the couch, and even as families, like we think our families are safe in that bubble. But what happens is as we get older, if we're sitting and we're not going out, we're not socializing, we're not exercising our bones and our muscles. So by doing that, we're actually doing the opposite. We're actually causing ourselves a greater chance of falling when we do get up and move around. So the house definitely, and there's definitely things you can do around the house. Why? People also ask me, why the house? Why not outside with the ice and the snow? Because we let our guard down. When we're in the house, we rush around. We don't think about our surroundings. We want to, do that laundry downstairs and go down once. So we make sure our hands are full. But when we're out, if we're outside where we don't know, we always look around. We make sure if we have a cane, if we need it, we'll bring it with us. But in the house, we're like, we don't need it. So it's important that in the home, we make sure about keeping clutter put away. We make sure that you observe at all times what you're doing. Don't rush, to get the phone or the door, and just wear the proper shoes, not those flip-flops, throw those away. They're awful. They will cause you to go down. Rugs. And a lot of people tell me, you know what, I've been doing it for years and it's never happened before. But the challenge is it only needs to happen once for you to sustain a brain injury. And do you really want to take that chance? So I guess my message is be proactive.
Right. So Jillian, can you tell us a little bit about occupational therapy and how it can help seniors prevent a fall?
Sure. Occupational therapy really is focused on helping individuals figure out how they can do the things that they want to do and need to do on a daily basis with as much safety and independence as possible. So in order to prevent falls, we're going to look for identifying risk factors that the individual might have. And then we go forward to provide education and training. We identify helpful tools and equipment that they may use at home and recommend home modifications if necessary.
Gotcha. So are there like any indications or almost like warning signs that you might look for to determine if a senior, would be eligible or benefit from occupational therapy?
Yep. So physical factors would look like decreased balance, impairments in vision or any changes in vision, decreased strength or endurance. Some of the cognitive factors that we look for are unsafe or impulsive behaviors. Maybe someone's not aware of the mistakes that they're making or things that they're doing that would put them at a risk for a fall and confusion. And then environmental factors, like Laura was saying, if there's a lot of clutter in the house, if they have a decreased ability to access any specific areas in their home, the bathroom is a big one that we do a lot of modification recommendations for. But anywhere that they really can't access safely or independently anymore, that would be something we would want to refer to OT for, so we can get a better overall picture and provide some good guidance.
Yeah, that makes sense. I wouldn't have thought about those, that like vision and balance and how all of those things can play a role. Carolyn, can you just tell us a little bit about physical therapy for seniors specifically, and if there's any exercises that they can do on their own to prevent a fall or to feel more confident?
Sure. Well, just like Laura said, keeping mobile and keeping active is really key. So to have more strength, to have more flexibility, and to have more endurance, those things are all going to be positive factors in your ability to minimize some of your fall risk, or to be able to regain balance if you do lose your balance. So maybe you trip, but if you have enough strength, you have enough flexibility, you might be able to catch yourself and minimize a more catastrophic injury. So what we think about with balance is that we have our ankles that are involved, and we have our hips that are involved, and our trunk. So I think some great exercises are just working on ankle strength. So some calf raises and heel raises, working on making sure your knees and your hips are strong so that they can react. So even some squats and some lunges, and also having your spine have mobility, which means rotation and flexion and extension, so that you can bend down and stand up. A lot of times as we get older, our spines get more stiff, and we want to make sure that your body can move as it needs to react to stimulus and things going on around it. So some trunk rotation and those types of exercises can be really helpful as well. But flexibility is also a really big key. So when people's ankles are tight and their calves are tight, they can end up not being able to clear their toes as well with walking. So just like when you were, maybe in school and you did those sprinters stretch against the wall, you run and you stretch out that calf. That's a really great exercise to do, and stretch out those hamstrings so that your pelvis can move, and do some trunk rotation, either in standing or in sitting, or even laying down, in order to get that trunk loosened up. So those can be really helpful exercises. And if you're in physical therapy, we might do things like working in situations where your vision is blocked. So maybe we have blurry glasses that we have people work with. We can do things with your eyes closed, and we can play with the different surfaces that people can stand on in order to better integrate some of your balance systems that we use. And those are things, though, that I wouldn't want you to do at home from a safety perspective without the guidance of a physical therapist, because we don't want to have a fall while we're training to do exercises to not fall.
Right. That makes sense. That's all great stuff to know. Laura, what can family members do, or caregivers, to prevent a loved one from a fall, or help kind of empower them to get stronger and prevent a fall?
I think that's such a great question, Kristen. I always like to start out with when I'm working with seniors to remind myself and them that they're older, more mature, they've gone through a lot, and that their number one concern is that they have to be their number one advocate for themselves. But with that said, also families, think about it. The last year we've been stuck in our houses in that bubble. We try to make our parents like that all the time. Maybe this kind of has opened our eyes that that's not what we want for our parents after doing so much, but we want to make sure they're safe. And I love listening to Jillian and Carolyn, because I work a lot with OT and PT. and they've taught different ways on how to get up. So for families, you know, if you do find yourself in a fall, a senior, one, make sure you always have a cell phone on you. Even if you can't afford a cell phone, get an older one, keep it charged, it dials 911. You don't have to have a plan if you can't afford one, but keep it on you, even if you get out of bed in the middle of the night, because this is many times where the seniors have told me they've held it all day, but then they got up that 2 minutes in the middle of the night and was stuck on the bathroom floor. So just make sure every time you're out of the bed to have that phone on you. Families, you know, help your senior mother, father, your spouse, on how to be an advocate for themselves when they go to the doctors, to ask the right questions. And if they don't remember, tape it, you know, things like this. So that's what we just like to make sure that families work with the seniors to remember that they raised them. Like they're brilliant people. Let's not treat them like they're children, but also let's make sure that we keep that communication open, that we're not hiding things from one another, because that's what I tend to see. Seniors not talking to their families because they're afraid of that. And we don't want that. You need to know and understand if you did fall, why, and correct that so you can stay independent.
Yeah, that's great advice. That's really, really good advice. So we've talked about prevention and everything, but as we all know, the falls, they happen. So we want to be prepared to how we can deal with that when it does happen, as a family member, as a caregiver, and as a senior. So Jillian, as an occupational therapist, what might you do after a fall?
So after a fall, we would work with the client and their caregivers to identify the reasons that they fell in the first place. So really get down to the root of what caused that fall. So if it was a physical malfunction, then we will figure out how to work on their balance. We'll figure out what activity were they doing during the fall. That's one of the big pieces of OT. What activity caused the fall, and how can we modify either the client's approach to the activity or the environment in which the activity is taking place so that we can avoid falls in the future. Again, recommendation of tools like a grabber to pick things up off the floor if that's how the fall occurred, and then home modifications, grab bars in the bathtub if it's a situation of climbing over the tub that's just too difficult. How can we, again, make the activity easier or the environment more suitable to complete the activity safely?
Right, that makes sense. So then, if a senior does fall down, we talked about maybe being stuck on the bathroom floor or around the home. What should or shouldn't they do, Carolyn?
Give me a tough one here, because
I know
there are a lot of different outcomes that could come from a fall, right? And there are, visible the things that are a little bit more clear of, oh, geez, I'm really in trouble. And there might be more hidden issues that, I think I'm okay. So Laura's exactly right. You want to make sure that you have a phone or some other means to get help. And so if it's a life alert or any of the emergency buttons or the phone or whatever that might be, or call for help, if you have someone who lives with living with other people, call for help. Don't try and get up on your own if that's not an option. If that's an option that there might be someone else that can help you, call for help. You don't want to end up having another slip and fall because of that fall. And so one of the big things is if there's no obvious injury, right, then just do a quick safety check of yourself. Can I move my ankles? Can I move my knee? Can I move my wrists and hands? Okay. Do I seem like it might be okay to give this a shot, and try and get yourself to an environment where you can get more help. So maybe you don't have your phone on you because you were standing in the shower and you don't have your phone there. But if you can do a quick safety check and figure out, I can safely move to be able to call and get support, then go ahead and do that. Using some environmental supports to get up is really key. So if you're in maybe your living room or in an environment where you can crawl over to a chair or a sofa or the side of the tub or whatever that might be, to use that to get up, that's going to be more helpful than just trying to get up without any support. If you notice that, I'm really hurting, something is really not right, don't move. If you can call 911, if you can get a family member, then do that and wait for support to get there. So that's kind of the big piece on that. What I would say though is if you have hit your head, regardless of whether or not it's just a little, you perceive it as being a little bump or you hit it really hard, you should call at 911 or at the very minimum, your physician. The reason being is that 911 or that when someone hits their head, when they fall, there can be bleeding in the brain that can occur either immediately or it might occur over some time. And a lot of our seniors have medications that might make this more likely to happen. So even after a few hours or days, you might see a change in the person's function or their personality or their cognition. Those are emergency situations that you need to get to the hospital. So if you fall, you hit your head, even just a little ding, right? You need to be safe and let your physician know that this has happened because you're going to want to be monitored for safety reasons.
Right, right. So it sounds like the best way to get up from a fall is number one, help, right? Someone else, equipment around you. And second, if you don't have any of those options, safety check is like integral to the beginning of any of it. Make sure that you're okay before you move, right?
Right.
So we talked a little bit about like the emergency indicators for after a fall, like when you should go to the emergency room and 911. But what happens, when you don't necessarily feel those things? I mean, over time, sometimes symptoms can exacerbate and get worse. So Jillian, do you have any advice for when someone should seek medical attention?
So definitely emergency medical attention immediately.
Right.
If there's any dizziness, nausea, headache, confusion, like Carolyn said, if there's any type of behavior change or personality change. And then additionally, if there's any ongoing movement issues, if you really, you didn't think you injured yourself, but maybe you find that your neck is still stiff a couple of days later.
Right.
But again, if I completely agree with Carolyn, if you hit your head at all, that prompts an emergency visit to either the ER or your physician as soon as possible.
Yeah, absolutely. And better safe than sorry, I think 100 times out of 100 times. Always better safe than sorry. Laura, what does BI&J do to support seniors?
Well, there's so many great things that Carolyn and Jillian was saying. I was like, oh, you're right. Carolyn, you just said one thing. Can I just touch on it really quick?
Yeah, go for it.
You mentioned something about being in the shower. And so many seniors come up to me and tell me that they put their phone on the sink, but then they fall in the tub or the shower and they can't reach it. So it's important for seniors to realize, like now I put it on, like I'll put a towel on the toilet top and put it there so that if I'm on the floor, I can still reach that phone. So that's great. And then the other thing Jillian was saying, sorry, because I work with so many OTs, I'm so excited about this topic. I don't know. That, yeah, so you definitely have to feel if anything's wrong, but if you feel that nothing's broken or if one part hurts, you use your other parts to scooch over to the stairs and pull yourself up on the stairs and then the banister. And if you don't have stairs, because many of them then go, well, I don't have stairs, I don't have stairs. Go to the couch and pull the cushions off and make stairs out of the cushions to get up if you didn't listen to me and have a phone on you at all times. So that's what I always tell them. So thank you guys.
That's good. That's good advice too. That's great.
But the Brain Injury Alliance, I love this company. It does so much for everybody throughout the state of New Jersey, especially for us seniors. So one, many people don't even recognize what a brain injury is. When we go out and give trainings and we ask, who knows someone with a brain injury, not even half of the room will raise their hand. And then when we ask about concussion, stroke, aneurysm, then by the end, everybody's hand is raised. So the first thing we do is we educate people on what a brain injury actually is, and then that they can reach out to us. So we have information on, we definitely want to prevent brain injuries at all costs. But like Kristen said before, if you do find yourself in a fall or hitting your head and you have to go, we also, it happens in a second, as we all know. And so we have to become experts if we're the caregivers or the person in a second on what questions we need to ask. The Brain Injury Alliance has thousands of pieces of literature, questions for specific doctors to give to you so you can bring and have 20 checkoffs so you know you cover everything. And then we also provide support groups for the caregiver and for the individual that has sustained a brain injury. And right now we're doing that virtually because we want to make sure that everybody gets the support whenever they need it. And then like today, we go out and we provide free trainings so I've gone to many senior centers, and we do it in a fun Jeopardy style way, but so that it becomes, so people think about it and they come up with the answers, and we find out what the fears are, like not wanting to use a cane because it makes them look old, things like that, and what we need to address moving forward. So, the brain, and I brought the helpline because I don't go anywhere without it.
Mm-hmm.
While we're working from home, the number is 732-783-6172. No stupid questions, call with anything, and we're always there for you. Thank you, Kristen.
Right. Yeah, I do want to mention for the helpline too, sometimes after a brain injury, it can be difficult to verbalize exactly what you're feeling, and you need more time to have those conversations. You can always send us an email at info@bianj.org. That's info@bianj.org. We're always available there. Our specialists can kind of like assess your needs, whether you're a caregiver or you're a senior who has fallen, and figure out how to connect you to resources or providers like Bancroft. So thank you everybody for your time. This was such an important topic, and I'm so glad that, we got to raise brain injury awareness and focus on seniors and kind of give them the advice that is going to be so important going forward. So thank you again, everybody.
Thank you.
All right. Have a good one.